In fascial LRA, Locoregional Anesthesia techniques, the maxillary block involves targeting the V2 second branch of the trigeminal nerve. For this procedure, a 50 mm echogenic needle and a long-acting local anesthetic, such as narrowpine, potentialized by intravenous dexamethasone, are used. A linear probe with the depth setting of 4 cm is also employed. This technique is performed under general anesthesia. The operator is at the patient's bedside. The echograph near the right or left shoulder, and the ultrasound probe is placed under the zygomatic arch to locate the PT erigopalatine fossa. On the ultrasound screen, the ascending branch of the mandible, maxillary bone, and the PT erigopalatine fossa are identified as the 3 reference points for the maxillary block. The puncture point is situated at the angle between the external pillar of the orbit and the zygomatic arch, using the suprazygomatic out-of-plane approach. Once the skin plane is crossed, the needle is advanced 1 cm towards the orbit with a 90-degree angle between the needle and the skin. Then, the needle is redirected caudally towards the middle of the nose. A suction test is performed, followed by a careful injection under echo control. The objective is to observe the local anesthetic diffusing towards the depth of the PT erigopalatine fossa, lifting the structures towards the surface. Although the maxillary nerve is not directly visualized during this diffusion block, a Doppler shot at the bottom of the fossa can sometimes help locate the maxillary artery, whose puncture must be avoided. The same procedure is then repeated on the patient's right side. The landmarks, ascending branch of the mandible, maxillary bone, and the PT erigopalatine fossa are identified. And the puncture point between the pillar of the orbit and the zygomatic arch is targeted. The needle is directed towards the orbit for 1 cm before reorientation towards the base of the nose. The needle is advanced to the bony contact of the maxillary bone. An aspiration test is conducted, followed by a fractional injection until the structures from the depth of the PT erigopalatine fossa are lifted towards the surface, with diffusion of the local anesthetic towards the depth.